Arya, you can start gradually. See the admissions in the phone. Others, please see the admissions. And when they are almost done, we can see in the phone. Manju, if you have a second system someone has, please check and tell her as the people enter in.
Hi all, good evening.
Good evening.
Good evening, ma'am.
Good evening, ma'am.
Today we're going to discuss regarding reading subtest. In that part A, we are going to discuss.
Good evening, ma'am.
I think we can wait for some more minutes and then to start. Subtest.
Day 5, yeah.
Yeah, good evening, Naima in YouTube. Alfonso, good afternoon.
Good evening, ma'am.
Yeah, Katrina, good afternoon. Yeah, let everyone join. We can wait for 2-3 minutes. By the time, if you have the material back pen, you can just grab it. Sorry, I couldn't inform you the topic earlier. Okay. So before starting the session, we'll have a 1-minute silent prayer. So before starting the session, I'd like to thank Father Celine Joseph and all the admin panel members and the supporting members. Thank you very much for your support. So let's start today's session, reading part A. Let me share my screen. Yeah, hope it is visible to everyone.
Yes, ma'am.
Yes, ma'am.
Thank you. In Zoom, sorry, in YouTube. Yeah, Naima, today's topic is back pain. Yeah. So once again, welcome to EduSkills International. Today's subtest is reading, and in that reading part A. So as you all are aware about reading part A, it's like 20 questions and you need to complete within 15 minutes. And yes, of course, part B plus C, 6 plus 16 questions. So 22 questions and you need to finish within 45 minutes, okay? Okay, let's move to reading part A. Yeah. So even yesterday also we discussed the same, like to achieve a good score or A grade, you need to score at least 18 out of 20 in your part A. And most of us, including me, okay, what we are doing is like the greatest mistake we are doing is like we will target like for grade B, then we will end up in like grade C or C plus like that. So always think that you have to get grade A, okay, 450 to 500. In reading part A, you will get 4, okay, A, B, C, and D, and there will be one theme. And in that, 20 questions will be there. You need to complete within 15 minutes. And the greatest challenge or enemy is time. That is like when you will start your OET. But once... Sorry. Yeah. So once you become competent, okay, definitely this won't be a challenge for you. Then fourth one is expeditious reading or fast reading task. In reading part A, we need to read very quickly. Okay, we are just skimming all the 4 text. So in your reading part A, definitely you can finish in 10 minutes. Not even, you'll not take 15 minutes. Okay. So begin with the skim. Tip 2 is focus of each text. That is, for example, if the text A says definition, text B is clinical assessment, text C is complication, text D is post-operative care. This is just an example. Okay. So you need to identify the sequence or the focus of each text so that it will be easy to find out from which paragraph the question is from. Okay. So once you can identify that, it will be very easy to find out the answer. So skim for what? That is the next question. Skim for what? So skim for title, section headings, subheadings, names, number or percentage, sequential expressions, frequency expressions, scale, adjectives, negative expressions, and abbreviation. So I don't want to go in detail with all these, okay? Because we have already taken many sessions regarding this. Please go through it if you have any doubts regarding this, okay? So let's move to the next slide. Okay, identify, as I told, identify 4 text headings. You just write in your question booklet, okay, like this: definition, clinical assessment, treatment, post-operative, whatever is the sequence, you have to just write it in your question booklet. Okay, now understand the relationship and sequence, the same. What is the relationship between each paragraph or each text? Skim for text and highlight the clues, as we have discussed before. And today's topic is back pain. Okay. Yeah. So when you will get the question paper, it will be like this: text A, text B, okay, text C, and text D. So what you need to skim? These headings will not be there. See, in the text A, there is no heading. Okay. So if there is no heading, please read the topic sentence so that you will get an idea what they are going to discuss in a particular paragraph. Okay. Now in text A, you can just read like, okay, back pain is very common, affecting people of all ages. So regarding the back pain, they're just going to discuss, right? So here you can underline back pain, all ages, usually, all this, just skim, okay? Whatever is there, whatever words like what you're feeling, it's important for this particular paragraph, just underline that, okay? So a few days, it's a scale expression, then weeks or months, no need to read completely. Even these 3 headings is enough because they are just discussing back pain, acute back pain, persistent or chronic back pain. So it's the definition of back pain and the types of back pain, acute back pain, and chronic or persistent back pain. Okay. Now moving to next text, text B. They discussed regarding clinical assessment. Okay, so there is a heading here, clinical assessment, and the subheadings like gather previous history of back pain, carry out of these checks to see if the person has no specific back pain. Now investigations, then management of non-specific back pain for acute pain and for chronic pain or for persistent back pain. So in this paragraph, they are discussing regarding clinical assessment and management. So you can just give the heading like clinical assessment and management. Okay. Now move to text C. Causes of non-specific back pain. That means the reasons, right? Then self-care of non-specific back pain. So there are some reasons or causes here. Then self-care. No need to read it completely. You can just go through it, like just skim the paragraph. Aging, 30 or 40 more, high incidence, lack of regular exercise. So these are some reasons. Overweight, prolonged poor posture, pregnant women are more likely to develop back pain. So the causes of back pain or the reason for back pain. Now self-care. So managing weight, then quit smoking, then sitting or standing in one position, just avoid that. So these are some self-care we need to take. Then text D. Again, in text D, there is a heading, specific condition that cause back pain. Okay. What are the conditions which cause back pain? So sciatica, slip disc, then the issues that need medical attention, which includes all these, okay? Some of the medical conditions. So in this text D, they are just mentioning specific conditions for that cause back pain. Now you have an idea, right? What is the sequence or focus of each text? So this is the sequence of this particular reading part A, okay? So definition and types, clinical assessment and management, cause and self-care, specific conditions. Just write these headings, okay? These sequence or focus in your question booklet. Now you can move to question number 1 to 7. So when you will skim your text, for text, you can take only 2 minutes time to skim your text, okay? That means 30 seconds for each text. You need to complete it within 30 seconds so that the time will be 2 minutes for the complete skimming of reading part A. Okay. Then you can move to the questions 1 to 7. You can take here also 2 minutes time. Okay. 2 or maximum 3 minutes, but I'm sure that it won't take like 3 minutes. You can finish in 2 minutes time. Okay. Then again, when you will move to the questions 8 to 14, you will get 4 minutes time. Please complete in that time. Again, for the next set of questions also 4 minutes. Okay. So in 15 minutes, you can complete all your questions. But once you become competent, it will be like in 10 minutes, you can finish it. Like 3 minutes for the 8 to 20 questions. So total 6 minutes. And then 1 to 7 questions, you can complete in 2 minutes. So it will take only 10 minutes time. Okay. And once you finish your finish all the questions, please check your answers for any spelling mistakes. If you if you are writing any mistakes, okay, any spelling mistakes, they won't give you the mark. Okay. Now we can move to questions 1 to 7. So in which text can you find information about? So you need to just find out from which text this particular information from. Okay. So let's move to the question. So yeah, here text A is definition and types. Text B is clinical assessment and management. Text C is causes and self-care. And text C is text D is specific conditions. Okay. Can we start answering?
Yes.
Yes, ma'am.
Yes, ma'am.
In YouTube? Yeah. Okay. So first question. Reasons why of back pain with no obvious cause develops. So reasons. So
Option
definitely
C.
column will be there, your sequence or your focus.
It's A. C, ma'am.
C, ma'am.
Reasons.
Reason.
Okay, fine.
C.
You can just write your answers in a piece of paper, or if you have a book, you can just write your answers. We'll check it later. Now, second question is issues that may need the person to see a doctor urgently. And one more thing I just want to inform you all. When you, if you can't find out the key word or the hedging word or the key phrase, please try to find out the important words. Okay, sometimes it will be like one word or two phrases, whatever it is, fine. Okay, so for example, in second question here, issues that may need the person to see a doctor urgently. If you can understand with this word issues, then it will be fine. Otherwise, select one more phrase, see a doctor urgently. Okay.
Yes, ma'am.
Issues that may need the person to see a doctor urgently. From which text it will be?
B. B, ma'am.
Okay.
Management.
Okay, let's see later. Self-help strategies for people with back pain.
C.
C, ma'am.
Option C.
Okay. The test people may have to find the cause of their back pain. Somewhere
B,
we
ma'am.
read about investigations, right?
Yes, ma'am.
B.
Weighting assessment.
B. B.
Okay. What back pain feels like?
A.
And
A.
Why pregnancy increases the chances of a woman suffering back pain?
D. D. D.
Yet,
D.
the link between spinal stenosis and back pain.
D, ma'am.
D, ma'am.
Let us check the answers. Is it right? Reasons why of back pain with no obvious reasons. Reasons, causes, issues that may need a person to see the doctor urgently. Any doubt in this? Why it is D? When you will see a doctor urgently?
Specific condition.
See, a slip disc can cause issues that need immediate medical attention. Right?
yeah.
Immediate medical attention there, here to see a doctor urgently. So, text B. Self-help strategies. Self-care, right? The test people may have to find the cause of their back pain. So, cause of their back pain. Test people may have to find the cause of their back pain. So, test investigations they have discussed in clinical assessment. What back pain feels like? It's text A, definitely definition. Why pregnancy increases the chance of a woman suffering from back pain? So again, reasons why. The link between spinal stenosis and back pain. So the specific condition, spinal stenosis and back pain. So text D. Now, I think the second question, some of them have some like difficulty, or if you have doubt, what you have to do when you will do your OET exam. Okay, if you have any doubt like this, you are not sure, okay, from which text it is, skip that particular question. Skipping is also a skill. Don't think like, okay, when I'm practicing, I can just find out the answers. But when I'll do my exam, I'll just skip that question. No, it is not at all possible. Whatever you are practicing here, that will appear in your exam. Okay. So try to learn how to skip also. Okay, skip the questions. If you don't know, if you are not sure from which text it is, or if you don't know how to find out the answer for a particular question, or if you are not able to find out the answer, please skip that question, move on to the next one. Okay. Once you finish all your questions, okay, then you can come back and find out the answer which you have skipped already. Okay. Is that fine?
Yes,
Yes,
ma'am.
ma'am.
Yes.
Yes, ma'am.
So I'll show the synonyms here. Synonyms or synonymous language. Reasons. In question, it's reasons, and in the text, it is causes. Again, self-help strategies in the question statement, but they have mentioned in the text, it's self-care. Then in question statement, there are the word is test, and in the text, it is investigations. Then increases the chances. In your text, it is more likely to develop. Then in question, they asked regarding see doctor urgently. That means immediate medical attention. Most of the time, I think most of the aspirants, what they will do is like, they will just search the same word in the question statement. Okay. In the text also. No, they won't give the same word in the question statement as well as in the text. They'll use definitely the synonyms or the synonymous language, or they'll just paraphrase the sentence. Okay. Can we move to next set of questions?
Yes,
Yes,
ma'am.
ma'am. Yes, ma'am.
Okay, now 8th question. So here you need to just write a word or a short phrase. Okay. So what type of back pain can be eased with gentle exercises? Type of back pain. So this sequence you have to keep in your mind. Type of back pain means definition and types, right?
Yes.
In text A. So what you have to do? Just in text A, in text A, what will be your answer? Am I audible?
Acute back.
Yes, ma'am. Acute.
What type of back pain can be eased with gentle exercise?
Acute.
Yes, acute back pain, right? Now, the next question. Sorry, I shown the wrong. Yeah. I'm sorry. Yeah. So here, management of non-specific back pain for acute pain. Advise patient to keep moving, such as walking, light exercise, and swimming. Okay, so acute will be the answer. Next one, how long? That means definitely it will be a time period, right? Time expression.
Yes, ma'am. Time
How long
expression.
has a person been experiencing back pain if it is considered to be persistent? So from which text it will be? How long has a person been experiencing back pain if it is considered to be persistent?
Types, ma'am.
Types, right? Types.
A.
So here you can see persistent or chronic back. So
3
chronic
months.
back pain is when some part of the back has become damaged and continues for 3 months or longer. Okay. So the answer is 3 months. Now, 10th question. What sort of pain might a person be suffering from if they are referred to a pain management team? So pain management in which text?
B.
Text B. Okay. What will be your answer? No answer?
Ma'am, where it says,
What
okay.
sort of pain might a person be suffering from if they are referred to a pain management team? So if you're referring a patient to a pain management team, what sort of pain it will?
Persistent.
Persistent.
Yes, persistent.
For persistent back
Here,
pain.
for persistent back pain, supervised exercise with a physiotherapist or similar professional. Referral to pain management team. So it will be persistent pain. Okay, not acute. It's a persistent back pain. So the answer will be persistent. Now, 11th question. People over what age are at higher risk of back pain? Again, it will be a number, right? People over what age? Age will be a
Yes,
number,
ma'am.
right? Yes.
Yes,
So,
ma'am. Number.
people over what age are at higher risk of back pain? Which text it will be?
Text C.
Let's see.
Reasons or causes like, okay?
Reason or
Let's
cause.
see.
So, what will be your answer? Aging causes wear and tear on the spine. This means that people over age 30 or 40 are more at risk for back pain than younger individuals. Okay? Hope it is clear. Now,
Yes, ma'am.
what condition might a person have if they are experiencing pins and needles around their bottom? What condition? Conditions where we have discussed
D.
in text.
D. Specific
Yes.
condition. D.
Yes.
D.
So, what is your answer?
Slip disc.
The question
Slip
again.
disc.
What
Slip
condition might a person have if they are experiencing pins and needles around their bottom? So,
Slipped
a
disc.
slipped disc is when the
Slipped
soft
disc.
cushion of tissue between the bones in spine pushes out and presses on nerves. So, it is paraphrased, right? The sentence is paraphrased there. So, the meaning is same, but just replaced with another sentence, right? Now, which nerve carries information from the pelvic area to the toes? Which nerve carries information from the pelvic areas to the toes?
Text D.
Yes, text D. Where is the answer?
Ma'am, sciatic nerve. Text.
Yeah. Sciatica is inflammation of the sciatic nerve, which runs from
Nerve.
hip to feet. Okay, hips to feet. That means pelvic area to toes. See, they're not using the same words or same phrases there. We're just mentioning pelvic area to the toes. Here,
Toes.
in your answer, it is like hips to feet.
Feet.
Both are same, right?
Yes, ma'am. Feet and toes are same.
Now, moving to the 14th question. Being overweight can cause back pain and place stress on what parts of the body? So again, causes. So, text C,
Text C.
causes and self-care. Okay. Let's see what will be the answer. So, being overweight increases stress on the lower back as well as
Other
dash.
joints.
Answer. Yeah.
Other joints.
Other joints.
Yes. So, being overweight can cause back pain and place stress on what part of the body? Joints. Okay, other joints. Is it clear?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
And we move to questions. Yeah, before moving to the next part, just show the synonyms or synonymous language they have used here. So in the question, it is gentle exercise, but in your text, it is light exercise. Then here it's high risk. Then in the text, it is more at risk. Then in question, it's pelvic area, but in the text, it is hips. Then in the question statement, the word is feet, but in the text, it is toes. Hope it is clear, even in the YouTube.
Ma'am, I have a question.
Yeah.
Um,
Can we discuss
the
the
other
session
question.
later? Maybe at the end of the session.
All right.
Yeah, you can just mark it. We'll discuss it later.
All right.
Yeah,
Thank you.
So let's move to questions 15 to 20. Okay, so here also saying you can write a word or a short phrase. Okay, now 15th one. Over time, dash posture will raise the risk of a person developing back pain. Over time, dash posture will raise the risk of a person. So that is also again causes, right? Yes. So you can move to text C, find out your answer. Any type of prolonged, is that the question? Yeah.
Over
Any
time.
type of prolonged poor posture will over time substantially increase the risk of developing back pain, right? So prolonged
Yes, ma'am.
what? Poor
Over
posture.
time.
Yes. Yes. Here it is over time. Prolonged poor posture will raise the risk of a person developing back pain. Okay. Clear? Let's move to next question. 16. Massage and dash packs can ease acute back pain. So when you will read this question, definitely you will know like, okay, some packs, definitely it will be a hot pack or cold pack or something. Just assume your answers, okay, before even moving to the text. So here massage and something, okay, some packs can ease acute back pain. That means it's a care, right? Self-care.
Self-care, ma'am. Self-care.
Yes. So, yeah, self-care. So what will be your answer? Self-care of non-specific back pain. Here, most effective
Ma'am,
treatment,
last
managing
line.
weight, quitting smoking, relaxing, lifting and carrying. Yeah. Here, relaxation techniques to reduce stress levels and related muscle tension. Massage, heat or cold packs. So massage is here, packs is here. In between, the words missing is like heat or cold. Right? Second, right, heat or cold packs can ease acute back pain. Now, if a person has back pain for no detectable reason, it is called dash back pain. So it's a type of back pain, right? If a person has back pain for no detectable reason, it is called dash back pain. Here, if no obvious reason. See, they have used the synonymous language. If no obvious reason is found for the back pain, this is known as non-specific back pain. So what will be your answer?
Non-specific.
Non-specific. Okay. Now, a person with acute back pain should keep moving and include light exercise such as dash. So a person with acute back pain. So it's a management, right? Here. Should keep moving and include light exercise such as something. Okay.
Advise patient to keep moving such as walking and swimming. Walking and swimming.
Such as walking, light exercise, swimming.
Swimming.
Okay. So here light exercise is here. So just need to mention walking and swimming. Okay. Now 19th question. Sorry. Surgery or something. Okay. Dash is often needed if someone has a slipped disc. So again, slipped disc where we have discussed.
Text D.
Is it a specific condition?
D, ma'am.
Specific conditions. D.
Yes, specific condition. So a slip disc, sorry, not here, here. Slip disc is when the soft cushion of tissues, okay, it usually gets better slowly with rest, gentle exercise and painkillers, but manual therapy or surgery is sometimes needed. So your answer is surgery or manual therapy. Here it is manual therapy or surgery. Both are same. Okay. is sometimes needed. Is often needed if someone had a slipped disc. So your answer will be manual therapy. Now the last question. An X-ray and something, okay? There will be a gap or a computed tomography, CT or CAT scan are some of the options available to diagnose a back problem. So from which text it will be? X-ray,
B, ma'am.
Clinical
CT,
assessment.
all will
B.
in clinical
Investigation.
assessment, right?
B.
Yes. So, sorry. Yeah. What is the answer? For investigations, right? For possible sciatica or slip disc, an X-ray, magnetic resonance imaging or MRI, okay, or a computed tomography, CT or CAT scan may be required. So, what is your answer?
Magnetic resonance imaging.
Magnetic resonance imaging. So, when you will write, please be careful. Just copy the answer, okay? No need to make any spelling mistakes here. So, be very careful when you write all your answers, okay? Now, we'll just discuss regarding the synonyms or synonymous language. Here in the question, they just mentioned over time, but in the text it is prolonged. Both are same but different words, okay? Then question, raise the risk. Here, increase the risk. Question, no detectable reason, but in the text it is no obvious reason. Is that clear?
Yes, ma'am.
Yeah. I'm sorry. I know that I couldn't inform the topic earlier so that it will be difficult sometimes if you doesn't have the printout with you. We'll try to give the materials early before the next sessions. Okay. So now you can just discuss regarding the doubts here. I think forgot her name.
Mape asked.
Yeah. What's your doubt?
I was asking, there's a question. Yes, ma'am.
Arya, could you
Thank-
stop sharing,
Yeah.
Arya? If you're discussing, please stop sharing.
Okay, Father.
Yeah. I can go ahead. I can go ahead, ma'am.
Yeah, sure.
All right, thank you. I was asking where they was saying there's a question on a direct question where we're answering the question where it's indicating the numbers like the age. What's the age? The question was like higher risk. And then on the question text, it was 30 or 40. So if you
Okay.
write 30 or 40, meaning the answer is wrong, or that's what I wanted to get a classification there.
Yeah, you can write 30 or 40 even because they are just asking like I'll just check the this one once again. Okay. Can you just tell me the question number?
11.
Not this one.
11.
Because they're just asking like over what age or something like
11.
that.
Question
Okay.
11.
So if you're writing,
Yes.
Yes.
yeah, people over what age are at higher risk of
Yep.
back pain. Yeah, you can write
Yes.
even 30 or 40 also fine, but it's enough because over 30 is
Okay.
same as like 40 also, so it's fine.
Oh, all right, ma'am. All right.
Yeah.
Thank you.
Thank you.
All right. Okay.
So in YouTube, yeah.
Hi, Miss. I'm Anita here in Zoom. Anita Thomas.
Yes, Anita. Hi.
Hi. Hi. Just a doubt. The same question. Previous Miss asked. She asked the same question. I also had doubt. So it's clear.
Yeah.
And the question number 9. So it says
Okay.
about the answer is 3 months. So do we need to complete it like 3 months or longer? Something we need to add?
Yeah, 3 months is enough.
3 months is enough.
Yeah.
And just one more doubt. See, if an answer is like a hyphenated answers, no? Like for example, in the next page, can you just take that next page, 15 to 20 page? Like hyphen, in between, if a hyphen comes, should we write, in case we miss the hyphen, just copy pasting. So if it is the hyphen
It's a
is
copy
present,
pasting, so definitely you have to write the
it
hyphen
should be,
also.
right? Yeah, okay.
Yeah.
That's all. Thank you.
That's why we are saying like it's like a copy paste. So whatever is there in your booklet, the same thing you need to write in your answer booklet also.
Okay.
Because in
So
reading part A, all the answers are there. It's not like in B or C, you need to find out the answer. It's all the answers are there. You're just copying the answers to the answer booklet. You're just finding out and just copying it. So definitely whatever is there, the same thing you need to mention it.
okay, there's a small clarification because that requires for reading part A, right? That's why I just asked. I know it's so simple. And even the last one, like for example, magnetic resonance image, MRI. So should we need to write MRI also?
You can write MRI also, there is no problem. No issues.
It's okay.
If there is abbreviation there, you can write that MRI, no problem with that. But if there is no abbreviation, if it is only like resonance imaging, and the MRI is not there in your text booklet, please don't write the abbreviation. If it is there, definitely you can write, no issues. But if it is not there, please don't use that.
Yeah, in case 2 are there, we don't write 1 also, fine. And that like you have
it's
written.
Fine. If you are writing both also fine. If you are writing only MRI or the abbreviation, it's fine.
Magnetic resonance. Okay,
Yeah.
fine. Thank you so much.
It's okay. Sure. Any doubts? Thank you for the explanation. Yeah, thank you, Jilumol. Hope it is clear to everyone.
Yes, ma'am.
Yeah, because I think almost many of them requested even the sessions day before yesterday, like they need more part A. Actually, part A is very easy once you become competent, like once you know all the strategies and tips. The only problem is with the timing. That is also, you can definitely manage it maybe after some practice. Okay. And even after finishing your answers, please recheck your answers for the spelling mistakes. Because most of the time we'll think like, okay, as a nurse for 10 years or 15 years or 20 years, I know the spelling, okay. But no, sometimes it happens. You think like, okay, I've written the correct answer, I know that the answer is correct. But if there is a spelling mistake, definitely they won't give you the mark. Even if it is a single mistake. That's why I told Anita, even there is a hyphen, please make sure it is there in your answer. I
Okay.
don't want to take any risk, right? Okay, in YouTube, there is a question. Do we need to read the text first or question, then skim the text? Now, when you will get the text, just skim the text and move to the questions. Because even if you read the question first, again, you have to come and skim the text. So you're just simply wasting your time. So it's better skim the text first, understand the focus of each text, find out the sequence so that the sequence will be in your mind. So when you will read the questions, 1 to 7 questions, even no need to go back to your text if you know the sequence. Okay, in your mind, that sequence is there. You can just write all those 7 questions immediately. You can just answer it in a minute or 2 minute time. Okay. Okay, Suni, can we skip doubtful question and need to read full text after finishing answers? Can we get time for that? Yeah, definitely you will get time. If you are not able to find out the answer for a particular question, skip that question and move on. If you are not skipping that question and think about that particular question for 2-3 minutes, then definitely you won't get time to complete all the questions. Because you are wasting your time there. Okay. So don't worry about that. Definitely you will get time. Even if it is like 2-3 questions or 4 questions, if you are not able to find out that, skip that and move on. Okay. So once you finish the other 16 questions, you will get time to find out that 4 questions. Sometimes when you will go through the paragraph, you can find out the answer for those questions you have skipped already. Okay. We speak about skipping. We feel like, okay, it's not a big task. We can do it. But no. We will think like, okay, I'll find out the answer, then I will move to the next question. So we'll just waste our time there. Okay. Yes, thank you all. Yeah, those who are in the YouTube. Yeah. So you told make a note of definition causes in the exam booklet. Yeah, you definitely you can write. You can write the sequence or focus of each text in your text booklet. Anyway, you're not writing in your answer booklet. The answer booklet will be separate and the question booklet will be separate. Okay. You can write it in your text booklet. Okay. So the text booklet will be different and the question and answer booklet will be different. So you can just write in your text booklet. Okay. Hope it is clear. Because when you will write and keep, it will be very easy. No need to read the complete paragraph to find out from which text it is. Just write like A, whatever is, for example, definition. B is assessment or management, whatever it is. C is like some care or what is there in the particular paragraph. Then D is like some prevention or complication, whatever it is. Okay. Yes, Alfonso, thank you. Saraswati, how are you? Yes, I think Yasumi. Yes, I'm good, thank you. Yes. So any doubts, anything? Otherwise, I think we can stop. Nothing to discuss.
Arya ma'am, thank you so much for your valuable time.
It's fine. Thank you.
Yes, ma'am.
Dear friends, you can throw questions. She's an reading part expert.
Not an expert, but yeah, definitely whatever I know, I can share it. Yeah.
Part A specialist. Arya ma'am can explain you how you can complete your answers in 10 minutes with your maximum of 12 minutes. These are all the tips.
And yeah, see, take it as a game. Don't think like, okay, how can I complete this in these questions, like 20 questions in 15 minutes time or 10 minutes time or whatever it is. Okay, just take it as a game, complete it. And for that, you need to practice consistently. I think some of our aspirants also, they are saying like, okay, today I'll practice, but I don't think for the next 3-4 days I can do it because of my hectic schedule, family, or whatever it is. See, definitely you have to spend some time for yourself, for your OET journey. Otherwise, it will be very difficult. You have to practice consistently. That means daily, at least 15 to 20 minutes, at least. If you can spend 1 hour, it will be definitely grateful. Otherwise, spend 15 to 20 minutes at least. Daily, you have to practice. I'm not saying like a lot of materials you need to do, but whatever you're doing, like just, it's not the quantity, it's the quality of material and the quality time that you are practicing. And we don't recommend to practice all your subtests together in a day. You can just select a part of it. For example, if you're doing reading, you can just do a reading part A at least. Then next day you can do the reading part B. But before you're going to your exam, you just make sure that at least 2-3 mock tests you have completed. Okay. So daily practice is definitely necessary. And don't practice when you are tired. Okay. Then it is not a quality time. For some namesake, you are doing practice. So we don't recommend that.
Ma'am, nurses only give that time.
I don't think all the nurses are doing 24-hour shift. I think maybe if you're doing 12-hour shift, definitely in a week you will be doing like 3 days in a week. And if you're doing 8 hours shift, then you will get 2 days off or at least one day week off. And in a day, I think it's 24 hours. So you're doing duty for 8 hours. Balance time is there. So definitely you can do it. Even if you're sleeping for 10 hours, still you have time. I know that you'll say like, okay, family is there. I need to prepare food. I have to go back of my kids, their school, all those things. Yeah. But love yourself. Just find out some time for that. I don't think no one can give that except you. But I think most of the nurses, they forget to do it. They'll be always back of their family, their workplace. Even after finishing the duty, they'll come back with all those tensions. I don't think it is necessary. Once you finish, it finished. Yes, Suni, confused in text, it's written differently. Yeah, because see, in one question, is there like light exercise including walking? Yeah. They will change the sentence. Sometimes they'll use the synonym, sometimes they'll just use the synonymous language, and sometimes it will be paraphrasing. So the order will be like not the same. So when you will find out the answer, read it, understand what they have mentioned in that particular sentence, okay, what it meant. So it will be easy to find out the answer. Don't blindly search for the same word which you read in your question statement. Definitely you can't find you cannot find the same word in the text. Okay. Okay. Further, I think there is no more questions in the YouTube. Maybe we can. Further.
Yes, done with.
Yes, I think so.
Suni's questions are answered, right? Which is in the.
Yes, Father.
Okay. That's cool. Great, Arya, ma'am. Thank you so much. God bless you. And
Your Father.
yeah, anything else?
And in the YouTube, if you're not there in the Telegram platform, please join. There is a link in the description box. You can just click and join with us, because all the information will be shared in the Telegram platform, not in the YouTube or in the WhatsApp group. So if you can join in the Telegram, that would be really appreciated.
Anything else? Others want to share anything?
Suni, thank you. Yeah, thank you, Suni.
And if you have something else to tell others? Am I audible?
Yes, Father.
Those who are at the Zoom, if you have at the Zoom, if you have any message for newcomers. I can't speak. There is some problem with my audio. Anybody wants to share anything, encourage others, those newcomers in the Zoom or YouTube? I can't speak because I'm getting echoes here. I think some issue with my audio.
Yeah, Father. I think everyone knows this is a free platform, but still, if you don't know that it's a free platform, it's a free OET training platform. So you'll get a lot of materials in the Telegram platform in the file segment. Okay. No need to pay a single rupee for any of the materials or any of the sessions. So if you're ready to learn OET, if you're a consistent OET student, definitely you can join with us. Okay. And I don't think that anywhere else you will get a chance like this. Even if you are ready to take sessions to others, to help others, definitely you can just inform any of the admins or Father Celine Joseph regarding that. We'll help you for that. Any other questions in YouTube? Alfonso, yes, Alfonso, thank you. Yes, Alfonso, most of my doubts were cleared. Okay. Thank you. At least I can clear some doubts. See, whatever you know, can just share it to others, okay? Even if it is a like a single thing, yeah, it's fine. If you want to share your knowledge, just inform us. We'll definitely arrange a Zoom session, okay, so that you can also take some sessions. Ibida is thinking something and smiling. You wish to take a session?
First I will attend the exam, and after I pass the exam, then I will. Then I can share the experience, before that.
Do you
Yeah,
think
I
like when
still
you
I
will
didn't
write your
attend it.
exam, you will get some experience to take a
Yeah,
session?
because in my life I didn't attend any OET or IELTS. This is the first time. That's why
This is the best place.
Yes.
See, when you will take sessions, you will be more competent. You'll become more competent.
Yes, ma'am. Today I just explained my daughter about my experience, because she's studying in the second PUC, and she's tried to write the IELTS exam, and I also started to study the OET. Then what I learned from our father side, then I explained to her today. That's
Very
why,
good.
that's why I said.
You can definitely take a session. It's nothing like, okay, when you will, once you wrote your exam, you can come back and take a sessions. Nothing like that. You can take sessions even now. So you will become more competent and you'll become more confident.
Yes. Okay, ma'am.
Yeah.
I will look at the companion, and then I
Not
will
saying like,
start
okay, you
it.
have to take the complete reading part A or complete reading part B or C, whatever subtest it is. You can even take a question,
Yeah.
just analyze that question, just to share how you got the answer. Definitely, it will be helpful for others.
Okay.
Yeah, no need to take a complete part B, part C, or part A, whatever it is. Even if it is a simple question, we are really happy.
Okay.
Yeah.
Thank you, ma'am.
Suni, really, Father, if I get depressed and stopped learning, your class is motivating me, killing my sleep. So again, I start learning. You are such a blessed. Bless you. And yes, Suni, thank you. Anjali, I'm confused for that about job and OET practice. Okay, I am working 12 hours, but after finishing my shift, I'm not able to do my task. Yeah. So before going your shift, you can do it. Otherwise, when you will get off days, you can do it. If you're on 12 hours shift. Okay. Have a strong decision that, okay, I will do it at least for 15 minutes. I think everybody will spend some time to watch reels or YouTube videos. Am I right?
Yes.
Correct, no? I know everyone will do it, even I'll do it. So spend that time, maybe from that 1 hour, just take that 15 minutes out. Okay. And practice it. Some X in question, if there is an acute back pain in answer option, I have to write only pain if we write mistake due to X. Stress whether they comes. Okay. Because of your exam stress, if you're writing wrong answers, the OET examiners, they doesn't know that you are in stress and you are writing wrong answers because of your stress. So definitely they are not going to give you the mark. Okay. You're writing wrong answers because of the stress or whatever it is, they won't give you mark. That's what we are saying, like, okay, you have to practice daily. Okay. So once you become competent, I don't think you will be stressed when you will do your exams. Because you know that you can finish in 10 minutes time or 15 minutes time, or you can complete your part B and part C in 45 minutes time. So definitely you won't be stressed if you know the strategies and tips, if you are competent. And don't book your exams like before starting your OET journey. I think some of them are doing like that, because when you will plan for your OET, you will book your exam first. That is also like even in 1 month time, some of them will book in 20 minutes as 20 days time or 2 months time. I feel like it definitely takes 3 to 4 months time at least to become competent. So book your exams once you become competent, not before that. And if you're feeling like, okay, I have already booked the exam and I don't think I'm competent enough, please reschedule it, okay? There is option for that. Maybe I think you have to pay 8,000 rupees or 9,000, something like that. Okay, but you can rebook it. Just defer that date. Okay, yeah. Which one is the best option from 1 to 7 or from 8 to 20 to save the time? Okay, anyway, you cannot save the time. You can complete on time, but you have to start from 1 to 20. We don't recommend to start from 7 to 20 because 1 to 7 questions will take maybe maximum 2 minutes time. So complete it and move on so that it will be easy. Otherwise, when you will start from 7 to 20, if you're stuck somewhere, okay, for example, in the 14th question or 15th question, if you're not able to find out the answer, you'll be stuck there, okay? Some of them will not skip the questions. They'll think like, okay, I will find out the answer, then I'll move on. So by the time, you cannot even touch that questions 1 to 7. So it's better to start from 1 to 20, and we don't recommend, EduSkills don't recommend to start from 8 to 20. Anjali, I have same doubt, yeah. Hope you got the answer. Yes, thank you, Sakhaya. Sankhaya, yeah. Okay, anything else? And if you're finding any materials, like any materials which is like difficult to find out the answers, you can just share the material to us. Okay. Yeah. If it is an authentic material, we'll try to take the sessions. Because I think almost all OET official samples we have already covered. So if you have some of the materials, then definitely, yeah, we can help it. Because sometimes not getting time to find out the materials. It's easy to take the sessions, but to find out the material, it's difficult. Even we have many materials, but to search and then find out. Yes, someone called me. Who was that?
Yes, ma'am.
Yes, Shibida.
Ma'am, how you know about the optional materials or it's a non-optional materials?
The official materials is there in the official sample, and it's if you're asking regarding the authentic materials, you're able to find out the answers with the strategies, then definitely it is of it's authentic material. If you're not able to find out or with the strategies and tips, then it's not. Yeah. See, definitely you can find out whether it's an authentic material or unauthentic materials by practice. When you read the questions or when you will read the text only, you can find out, okay, this material is not good.
Okay, thank you.
It's by practice. Any other questions in YouTube? Chandrakala, yes, hi. So in today's discussion, today's session, I didn't explain in detail regarding the things which you have to skim. Okay. I think we have taken many sessions regarding that. If you have any doubt, just go through it. And still, if you have confusion, just put a comment in this below this video. Chandrakala, can we start answering 1 to 7? Yes, 100%. Have to start from 1 to 7 only. See, still some of them have doubt whether to start from 1 or from 7. Start from 1. Miss Chandrakala, please start from 1 to 20, not from 8 to 20. Which one is best? Yeah. 1 to 7 is the best. Anything else you want to discuss? Nothing?
Are you all done? Hello?
Yes, Father. Yes, Father.
Yeah. And Arya Mama was motivating you to take a session. When should I fix it? I did not listen to, I was in a meeting. So I could not listen. Was it decided, Arya ma'am?
No, Shipata saying like, okay, once she finished her exam, she will do it.
No, we don't want anybody to take after the exam. Only those who have taken before the exam. Arya ma'am and all, they started from the beginning of their studies. That's why they are able to take now. We have never requested anybody who has successfully completed the exam to take up sessions. Arya ma'am, because she doesn't leave us. Even if you don't ask her, she will take. So she is taking exceptions. Otherwise, we call it student faculty, not teachers. Student faculty, you can find so many sessions all uploaded, right? All are student faculty, not after passing the exam. When they were studying, what is their experience? That's how you motivate others and strengthen others. Now, after passing, people will think, okay, these people have passed, they are brilliant, they are good, they are great, they did it easily, I cannot do it. But if you share, when you are learning, if you share your challenges, your difficulties, or how you managed your difficulties, okay, or which video helped you, or which was the great learning eye-opener for you, which session, which video, which point, something you could share. Not huge, maybe 3 minutes, 4 minutes. That will give you competence. So which day? Not one, 3, 4 can take it together. Maybe B, C, anything is okay, whatever you love. One can take B, one question, other one can take C, one question, no issues. Whatever is your favorite, so that others will be helped.
Even if you
I'll
want to
give you
do a
2 more.
trial, we are ready to open the Zoom for that.
Okay, anyhow, I will bye everybody at Zoom. I could not reach you today. We'll meet again now about YouTube. I am ending the stream at YouTube, okay, but Zoom I will not end.